After age 50, many people begin to experience problems in their legs and knees, making everyday movement harder than before. Walking is often seen as a solution, but it's simply not strong enough to rebuild muscles that have already weakened. This video introduces 7 easy chair-based exercises that help strengthen your legs, reduce knee pain, and improve mobility right at home. These movements are safe, simple, and especially ideal for older adults who want to regain flexibility without complicated equipment or a gym. If there's one exercise that can instantly change the strength of your legs after age 50, it's the sit to stand. This is a movement you perform dozens of times a day. Yet as we get older, the body slowly forgets how to use the most important muscles for this action, the glutes and the quadriceps. That quiet weakening is what makes getting up from a chair feel challenging. Climbing stairs feel heavy, and knee pain show up more often. The sit to stand reactivates this entire muscle chain and restores strength you may think you've already lost. To do it correctly, sit on the edge of a sturdy chair with both feet planted firmly on the floor, parallel and hip width apart. Keep your back straight, shoulders relaxed, and your arms crossed in front of your chest, or lightly resting on your knees if you're just starting out. Lean your torso slightly forward. This is the key step that activates your glutes and shifts your weight into your legs. Then press your feet strongly into the ground and rise until you're fully upright. Without locking your knees, hold your balance for a second. Then lower yourself slowly, guiding your hips back as if you're searching for the chair with your glutes, and sit down with control. Every rise and every sit should be slow, steady, and intentional. That's the secret to activating the right muscles instead of relying on momentum. During the first few sessions, you might feel your legs shake or get tired, and that's perfectly normal. It's a sign your muscles are waking up after years of being underused. Perform 8 to 12 repetitions. Rest 30 seconds, and repeat for 2 to 3 rounds. If you're new or have knee issues, use a taller chair to reduce the range of motion. As you get stronger, lower the chair height or perform the movement without using your hands. The sit to stand not only makes standing up easier, it dramatically strengthens your glutes, improves balance, reduces knee pain, and upgrades your daily quality of life. It's the simplest exercise, yet one of the most powerful for anyone over 50. Among all the causes of knee pain in people over 50, tight and shortened hamstrings are one of the most common, yet one of the most overlooked. When the hamstrings become stiff, they pull the back of the knee into an unnatural position, disrupt normal movement mechanics, and increase pressure on the tissues around the joint. Many people believe their knee arthritis is getting worse, when in reality, their hamstrings are simply too tight. This stretch helps release that tension and brings a feeling of lightness and flexibility in just a few sessions. To do it correctly, sit firmly on the edge of a chair, keep your back straight, and relax your shoulders. Extend one leg forward with your heel on the floor and your toes pointing up. The other leg stays bent at 90 degrees for support. Imagine lifting the top of your head upward. This helps keep your spine neutral and prevents rounding. From here, gently hinge forward from your hips, not your lower back. The most important rule is, your back stays straight. Lean only until you feel a comfortable stretch running along the back of your thigh. Do not force it, do not bounce, and do not try to touch your toes. This is a stretch, not a flexibility test. Hold the position for 15 to 20 seconds, breathing slowly and deeply to help your body relax. Return to the starting position. Switch legs, and repeat. Perform 3 rounds on each side. As your flexibility improves, you can hold the stretch for 30 seconds or lean slightly deeper. If you're new, you can place a rolled towel under your knee to ease the tension. As you get used to the movement, remove the towel for maximum benefit. The key is to feel a clear stretch, never sharp pain. This seated hamstring stretch is perfect for anyone who wakes up with stiff legs, feels tightness behind the knee, or struggles to fully straighten the leg when standing up. Just a few minutes a day can help you walk more smoothly, reduce that pulling sensation, and greatly improve your mobility. Among all the muscle groups in the lower body, the calves are one of the most important, and one of the most easily neglected, especially for people over 50. Weak legs aren't just about the thighs or glutes. In many cases, knee pain, leg fatigue, and even balance problems come from calf muscles that are no longer strong enough to support movement. The two main muscles in this area, the soleus and the gastrocnemius, work like a pump that pushes blood back to the heart, helping reduce swelling, ease heavy legs, and stabilize the knees every time you take a step. The seated heel raise is a safe and effective way to reactivate this muscle group without stressing the joints. To perform it, sit tall on the edge of a chair with your feet parallel and hip width apart. Keep your knees at a 90-degree angle and your entire foot on the floor. Slowly lift your heels as high as you can, keeping the balls of your feet grounded. You'll immediately feel your calf muscles contract strongly. Hold for 1 to 2 seconds at the top to boost muscle activation. Then lower your heels with control, as if you're resisting an invisible force pulling them down. This lowering phase, the eccentric phase, is where real strength is built. Many people make the mistake of lifting their heels too quickly or only lifting a little, which reduces the effectiveness of the exercise. For best results, lift as high as possible and control the entire descent. Perform 15 to 20 reps per set. Rest 30 to 45 seconds. And repeat for 2 to 3 sets. As your calves get stronger, you can increase the challenge by raising your heels using one leg instead of both, holding the top position for 3 to 5 seconds, increasing your reps to around 25, since calf muscles respond well to higher volume. This exercise is excellent for anyone with swollen feet, knee discomfort while walking, heavy calves, or frequent balance issues. It also improves circulation and reduces the risk of nighttime cramps. However, if you've had Achilles tendonitis, start with a smaller range of motion and lighter intensity, or check with a professional first. Just a few minutes a day can help your legs feel lighter, stronger, and more stable with every step. If I had to choose one exercise that can improve overall leg strength after age 50, the chair squat would undoubtedly be at the top of the list. This movement perfectly mimics the sit down, stand up action you perform dozens of times each day. The best part is that it activates several major muscle groups at once: the quadriceps, glutes, hamstrings, and even the deep stabilizing muscles of the hips and core. When these muscles work together, you stand up more easily, climb stairs with less effort, and take a great deal of pressure off your knees. To perform it correctly, place a sturdy chair against a wall so it doesn't slide. Stand in front of the chair with your feet shoulder-width apart and your toes turned out slightly, about 5 to 15 degrees. Keep your back straight, chest open, and eyes facing forward. Then push your hips back first, as if you're trying to sit on a chair placed slightly behind you. This is a key step that shifts the load into your hips instead of your knees. Continue lowering yourself slowly, keeping your knees aligned with your toes, not collapsing inward. When your glutes lightly touch the edge of the chair, don't sit down, just tap the chair for control. Then press through your heels to return to standing. This maximizes glute activation and reduces strain on the knees. The most common mistakes are letting the knees slide too far past the toes or rounding the back, both of which increase stress on the knees and lower back. Remember the golden rule: hips back first, chest up. Move slowly and with control. Do 8 to 10 repetitions. Rest 30 to 60 seconds. And repeat for 2 to 3 rounds. If your knees are weak or your balance feels unsteady, use a higher chair or place your hands lightly on a table for support. As you get stronger, lower the chair height or perform the movement without touching the chair at all. The chair squat is incredibly effective for older adults because it not only builds strength, but also improves coordination, balance, and overall body control, key factors for maintaining independence and preventing falls. After just a few weeks of practice, you'll feel the difference. Standing becomes easier, your knees feel more stable, and your walking posture becomes more confident. Among the exercise set for adults over 50, the pillow squeeze is gentle but surprisingly powerful for stabilizing the knees. If your knees often feel loose, wobbly, or you experience fatigue along the inner thighs, the cause is very likely weakness in the adductors, the deep muscles on the inner side of your thighs. When these muscles weaken, the knees tend to collapse inward, creating a faulty walking pattern that increases stress on the cartilage and ligaments. The pillow squeeze reactivates this muscle group without moving the knee joint, making it extremely safe for people with sensitive knees. To do it properly, sit on a sturdy chair with your back straight and your feet hip-width apart. Place a medium firm cushion or pillow between your knees. It should offer gentle resistance, not so soft that there's no challenge, and not so hard that it causes pain. From here, squeeze your knees together evenly, using the muscles of your inner thighs, not your feet or hips. Hold the squeeze for 5 seconds. Breathe slowly and deeply, then release about halfway, but don't fully relax. Repeat 10 times per set and perform 2 to 3 sets. While you do this exercise, keep your back straight, shoulders open, and core lightly engaged. This posture not only protects your back but also activates your core for additional support. A common mistake is rounding the back or leaning forward, which reduces effectiveness and may strain the lower back. Another mistake is squeezing too hard or unevenly. The goal is not to crush the pillow, it's to create a steady, controlled contraction that trains the adductors to work properly. As you get stronger, you can make the exercise harder by using a firmer pillow or holding each squeeze for 7 to 10 seconds instead of 5. The pillow squeeze is especially helpful for people with inner knee pain, those whose knees tend to collapse inward while walking, or anyone with a history of adductor weakness after injury. It's also an ideal exercise for days when your knees feel sore, because it strengthens the supporting muscles without requiring knee movement. With consistent daily practice, you'll feel your knees grow more stable, your posture become straighter, and your steps more confident over time. As we age, one of the fastest weakening muscle groups, and one of the most overlooked, is the hip flexors. These muscles are responsible for lifting your legs, stepping over obstacles, climbing stairs, getting into a car, and countless everyday movements. When the hip flexors weaken, you may notice slower steps, more frequent tripping, difficulty climbing stairs, and even aching down the front of your thigh. The seated knee raise is a gentle, safe, and highly effective way to reactivate this essential muscle group for adults over 50. To do it correctly, sit on the edge of a chair with your back straight, chest open, and shoulders relaxed. Place both feet firmly on the floor, hip-width apart. From this position, lift one knee toward your chest, raising it as high as you comfortably can. Hold for 1 to 2 seconds to allow your hip flexors and core to work together. Then lower your leg slowly. The key is not to lean back as you lift, because that reduces the exercise's effectiveness and shifts the load into your lower back. Another common mistake is dropping the leg too quickly. Think of lowering your leg in slow motion. The controlled lowering phase is what truly builds strength and stability in the hips. After finishing one side, switch to the other. Perform 10 to 15 repetitions per leg. Rest 30 to 60 seconds. And repeat for 2 to 3 rounds. As your hip flexors get stronger, you can level up the exercise by holding your knee at the top for 3 to 5 seconds, lifting the knee higher, adding a light ankle weight, with approval from a doctor or specialist. This exercise is especially helpful for people who struggle with stairs, often catch their toes while walking, or feel stiffness in the hips when standing up. It also makes lifting your leg to put on pants or shoes easier. Simple tasks that become challenging when the hip flexors weaken. However, if you have an acute groin hernia or sharp pain at the front of the hip, stop the exercise and consult a professional. When done correctly, the seated knee raise helps you walk more smoothly, move with better hip mobility, and feel more confident with every step. Within the system of muscles that support the knee, the quadriceps play the central role. This large muscle group at the front of your thigh stabilizes the kneecap, absorbs impact with every step, and helps the knee move smoothly. After age 50, the quadriceps often weaken quickly due to reduced activity, long hours of sitting, or knee pain that makes you hesitant to move. This weakness is one of the leading causes of knee pain, difficulty climbing stairs, heavy effort when standing up, and the feeling that your legs are no longer strong and steady. The seated knee extension is a key exercise for restoring this essential strength. To begin, sit tall in a chair with your back lightly supported and both feet planted firmly on the floor. Engage your core gently, as if drawing your belly button inward. From here, extend one leg forward, lifting your foot until your knee is almost fully straight, but not locked. At the same time, pull your toes toward you to increase quadriceps activation and improve knee alignment. Hold the extended position for 5 seconds, feeling the front of your thigh working strongly. Then lower your leg slowly, imagining you're lowering it through thick water. This slow, controlled movement is what builds deep, lasting strength. Repeat 10 times per leg and complete 2 to 3 rounds. If your knee is painful, start with a smaller range of motion and increase the height and hold time as your strength improves. Common mistakes include slouching, which shifts stress to the lower back instead of the thigh, kicking the leg too quickly, relying on momentum instead of muscle, locking the knee at full extension, which can cause discomfort. The seated knee extension is especially helpful for people who feel knee pain when climbing stairs, feel weakness when standing up, have unstable knee alignment, or have mild arthritis and need a low-impact exercise. Practicing this exercise daily strengthens the quadriceps, reduces pressure on the knee joint, and improves your movement in all daily activities, from walking, standing up, and sitting down to maintaining better balance. Leg strength after age 50 isn't determined by luck or age. It's shaped by the habits you build every day. With nothing more than a chair and a few minutes of practice, you can reduce knee pain, improve your balance, and regain the mobility you thought you had lost. These simple exercises don't just make your muscles stronger, they give you back confidence in every step you take. Start today. Stronger legs will open the door to a lighter, more energetic life.